History of opioids. Opium first became available in 1775. In the Civil War, veterans were given morphine for pain relief of combat injuries. Heroin became available in the late 1800s when pharmaceutical companies began producing synthetic opioids. At this time, the United States restricted the importation of opium for medicinal purposes only. In 1912, the United States and other countries signed the International Opium Convention to control the import, manufacture, and sale of morphine. The 1924 Anti-Heroin Act prohibited the manufacture, importation, and possession of heroin for medical purposes. During World War II, veterans were again given opioids for pain relief, but even after combat was over, many continued to use and misuse opioids. In the 1970s, additional opioids, such as oxycodone and hydrocodone, were developed and marketed for the relief of acute and cancer pain. The American Society of Anesthesiologists issued the reversal of prescribing opioids in 2014 due to the opioid abuse epidemic. Opioids are agonists which bind to opioid receptors to induce analgesic effects. There are high levels of opioid receptors in the same regions of the brain that regulate pain perception and pain-induced emotional response, which is why opioids are so effective in controlling severe acute pain as well as the regions managing the experience of pleasure and reward. When opioids bind to reward centers in the brain, dopamine is released, which accounts for the feeling of pleasure. Because of this, an opioid user subconsciously associates pleasure with the drug. There is significant evidence that opioids are effective for resting pain, acute severe pain, severe, short-term, exacerbations of chronic pain, and end-of-life pain. The practice of prescribing opioids as a first-line treatment for CNCP was reversed because opioids have many adverse effects and other treatments work just as well. Common side effects include dry mouth, nausea, constipation, sedation, dizziness, pruritus, and dermatological rashes. Following are the most serious adverse effects of hyperalgesia. Chronic exposure to opioids can result in a heightened sensitivity to pain. Inappropriate dosage increases can further worsen the patient's pain and increase the chance of dependence and addiction. Tolerance. The analgesic effects of opioids are less perceptible with each administration of the same dose, so larger doses of the drug are needed to achieve the same level of pain management as with the first dose. Physical dependence. Every time the intended effects of the opioid die down, the patient is faced with withdrawal symptoms, and a new pill is required to ease this pain, so opioid users literally depend on the drug to avoid the pain of withdrawal. Addiction and overdose. Addiction to prescription opioids is especially dangerous, as there is a notable risk for overdose, which can be fatal. Alternative treatment. Researchers studied the effects of 4 different drug regimens on patients with moderate to severe pain. They discovered that there was no statistical or clinical difference for pain management between these regimens. Even for severe pain, non-opioids work just as well as opioids. Currently, the state of the opioid crisis in America has begun to improve. From 1999 to 2017, prescription opioid-related deaths had steadily increased, climbing to over 17,000 in 2017. However, the opioid epidemic took a turn in 2018, 4 years after the reversal, when prescription opioid deaths decreased to less than 15,000. Resistance. Over time, the opioid high fades, but the drugs continue to trigger a chemical dependence, so the body stops producing natural opioids and relies instead on the drugs. Rather than facing withdrawal from long-term opioid use, patients may opt for suicide, which results in doctors hesitant to take their patients off of opioids for fear of having a hand in their deaths. To conclude, because of the serious adverse effects of opioids and the evidence of effective alternative treatments, the American Society of Anesthesiologists advises against the prescription of opioid analgesics as first-line treatment for chronic non-cancer pain. Thank you for watching.